I'd like to introduce myself to those of you who may be here for the first time. How many of you have been to the Women's Wellness Day for the very first time? Well, good. Then I guess I should introduce myself. My name is Catherine Champagne. If you're from South Louisiana, the Lafayette area, if you're in Baton Rouge, they usually say Champagne. Either way, it's a great name. I thank my dad for that. I have been here at the Pennington Center. I actually am the coordinator of the Women's Nutrition Research Program, which primarily tries to promote research and recruit women to be in our research studies. And you know, it's funny because if you if I gave you some statistical data on the people who want to volunteer for research studies, it's women. So it reinforces the fact that we are appreciative of women and realize that women are valuable assets to our research program here at Pennington. I have been here for almost 25 years, almost since they opened the doors here. I am a PhD in nutrition, and I have been primarily in charge of dietary assessment and nutrition counseling in conjunction with many of our research studies. And in fact, I've seen some of my participants from the past, from some of our very good weight loss studies, who say to me, gee, I wish there was another study for us to participate in, and we're looking for more. So stay tuned and visit our website, and hopefully we'll have another weight loss study coming up, that one that doesn't use drugs, because that's what I'm hearing. People don't want drugs, and I can agree with that. So what I want to do this morning is to really kind of put into context this whole event in terms of what these screenings actually mean to you. And so the title of my talk is Understanding Your Metabolic Health, but actually there's a term that talks about things that go along with being overweight or even obese actually, and that is metabolic syndrome. You'll understand after this particular talk why these screenings are very valuable to you, and maybe what you need to do if you find that you have some of these traits that I'm going to be talking about. So what is metabolic syndrome? Metabolic syndrome is best described as a group of risk factors that raise your risk for certain diseases. And those risk factors are central obesity defining a person who has an apple shape as opposed to a pear shape. So when the majority of your fat is in your tummy, I have a little bit of that too. So, you know, after you've had children, you know it's kind of hard to get rid of that belly fat. High triglycerides. Now we aren't going to be, we aren't going to be doing a screening for triglycerides here, and I'll tell you why shortly. A low HDL cholesterol. HDL is your good cholesterol, and I'll tell you what the numbers need to be, and you know what we do here about that. And high blood pressure, and you know, unfortunately, as we age, our blood pressure rises, but it rises even more if you are overweight or obese. And a high fasting blood glucose, and I'll talk about the screenings that we're doing here that actually have to do with your blood glucose. But let me give you some statistics. The U.S. estimates from the NHANES, which is the National Health and Nutrition Examination Survey that is conducted on a pretty yearly basis in the United States, has diagnosed about 34% of adults meeting the criteria for the metabolic syndrome. The problem is when we get older, it's 3 times more likely to occur in those women or those individuals, not just women actually, who are 49 to 50 years old than at a younger age, the age being 20 to 39. And you know, it used to be that it was, you know, we've done this research in the United States, but it's global. Metabolic syndrome is everywhere. There's other countries are concerned about it as well as the United States. So why do we concern ourselves with metabolic syndrome? Well, If you have metabolic syndrome, it increases your risk for cardiovascular disease. You're twice as likely to develop cardiovascular disease. You are at risk for type 2 diabetes, and it's 5 times more likely to develop. And I know that you know that when we talk about type 2 diabetes, you have friends or relatives who become diabetic as they get older and gain more weight. So that is a risk factor, the weight gain. Non-alcoholic fatty liver disease is also a risk. Hyperuricemia, which is, in the urine. Polycystic ovary syndrome, which is on people who are younger, but almost 50% of women who have polycystic ovary syndrome do have metabolic syndrome. And then obstructive sleep apnea. So you know that the snoring and the interrupted sleep is a problem with metabolic syndrome. So we're doing some screenings here, and I want to put into context some numbers that you might be particularly interested in, and some of these you may even want to write down. The thing about metabolic syndrome is those 5 factors that I mentioned, usually one by themselves may not be as much of a problem, but the metabolic syndrome means you have to have 3 of the 5 problems, and we can diagnose 3 of the 5 here today, or kind of at least maybe not diagnose it, but give you some data that you might want to get checked out by your physician. Okay, waist circumference. A large waistline is one of the hallmarks, as I mentioned. If you have excess fat in your stomach, you are at a greater risk for heart disease than excess fat in other parts of the body. The pear shape, the women who say I have these big hips, but you're probably a little bit better off than someone who has the apple shape. So you can have your waist circumference measured by the Pennington clinical staff here. It is downstairs, right across from where the coffee was. So they are doing some waist circumferences, and we're doing it the right way. So, and we're giving you a tape measure to keep, so that you can use that tape measure to see how you're progressing if you're going to lose weight. The waist circumference numbers are critical here. This one in red is the traditional one. So if your husband has a 40-inch waist, then that is a cause of concern. 40 or greater, and for women 35 or greater. So if I think my waist might be approaching, I think it might be getting to 35, but hopefully I'm just straight up and down like a little tank. But there's some concern even at a lower waist, in some women at 31.5 and for men at 37. So I think when you get to 31.5, 32, 33, you might say, well, I don't want to get to 40 or 38. And also note that if you are of a different ethnicity, African Americans actually are at the 31.5, but there's a lot of data that suggests that metabolic syndrome within the African American population is not as much of is not diagnosed as much, because you can have a larger than 35-inch waist and not have metabolic syndrome in the African American population. If you're Asian, the numbers are smaller, because the Asian population, that 31.5 is sort of the upper limit. So it is different, and I always tell people that, when we look at an individual, we have to treat the individual as an individual. We can't put them in a box and say that this is the number and this is what you need to abide by and go forward. But you need to know the numbers. So I would just keep that 35 if I were in mind, if I were you. So, and you can have your waist measured, as I mentioned. So 88 centimeters or 35 inches. High triglyceride levels if you're on a medicine to treat high triglycerides, that's kind of how you know that you have maybe that one hallmark of the metabolic syndrome. Triglycerides are a type of fat that is found in the blood, and since people need to be fasting for triglycerides, that is one reason we don't typically do it here, because the numbers would be probably alarming and you would maybe have some cause for concern, and we don't want to have undue cause for concern here. But the cut point for triglycerides is greater than or equal to 150 milligrams per deciliter. There are some additional numbers that I'll give you. Borderline high is 150 to 199, high 200, 499, and 500 for a very high. Cholesterol screening. As I mentioned before, a low HDL cholesterol level is one of the signs of the metabolic syndrome. That is your good cholesterol, the HDL cholesterol. It helps remove the total cholesterol from your arteries, so that's the function of HDL cholesterol. It also raises your risk. If it's too low, it raises your risk for other disease, and so the cut point for you as a woman should be if your HDL cholesterol is less than 40 milligrams per deciliter. 50 milligrams per deciliter, 40 for men. We're not doing HDL cholesterol here, but I just wanted to give you some other numbers, and I would tell you that we are doing screenings for cholesterol, and if your cholesterol is high, it may be that your good cholesterol may be low. So you need to know that those definite numbers. So I think it's easy for us to do cholesterol here because cholesterol does not have to be in a fasting state like triglycerides. So that's why we choose to do cholesterol here. But if your number's high, then I think you need to get it checked out by your physician. High blood pressure is one of the, as I said, one of the other factors of the metabolic syndrome. So unfortunately, a lot of us as we age are on cholesterol, on blood pressure medications. So if you're on blood pressure medication, then you know that you've got one of those factors. If it rises and stays high over time, then it can damage your heart and lead to plaque buildup. And your blood pressure should be no greater, the cut point is if your blood pressure is 130 over 85 or numbers that are higher than that, then you have some form of abnormally high blood pressure. And I think those numbers are, basically like indicative of perhaps even prehypertension. Prehypertension is 120 over 80, but the 130 over 85 is going towards stage 1 hypertension. So you need to be at least concerned about it. Blood pressure is one of those things that's kind of easy to prevent or treat if it is caused by perhaps diet. So a diet that's low in sodium is a good thing for you to do. Exercise is always helpful in that it helps to lower blood pressure. Maintaining a healthy weight, managing stress, which kind of sometimes is a little bit difficult to do. Avoiding smoking. Complying with your medication prescriptions if you are on blood pressure medications, and limiting alcohol consumption. That the blood pressure screenings, and I'm sure you all are aware of some of these, we're doing blood pressure screening in 2 areas. At Our Lady of the Lake, in the uppermost level, we are doing blood pressure screening, and also in the lowest level, Baton Rouge Cardiology is doing the blood pressure check, the blood cholesterol check is in the lowest level. So yes, blood pressure in one, blood cholesterol in the other. We're doing glucose in 2 areas. I guess I got a little bit confused here. But the high fasting blood sugar or previously diagnosed type 2 diabetes is that other hallmark. This may be a sign of early sign of diabetes, or what we call prediabetes. The cut point for a fasting blood glucose is equal or greater than 100 milligrams per deciliter, and this screening is done at both Our Lady of the Lake and at the Baton Rouge Cardiology Center areas. The one thing to know about blood glucose is that it's best to be fasting for at least 8 hours before you do the test. If you have fasted for that length of time and your blood glucose is greater than or equal to 100 milligrams per deciliter, then you need to have it checked at your physician's office. If you have not fasted and your blood glucose is greater than 140 milligrams per deciliter, then you probably should follow up at that point too. And I am told by some of the committee members that they will probably tell you that you need to follow up if it's 140 or greater. Body mass index is something that we're doing. We have an area, room 327, up in where the breakout sessions are on the 3rd floor level, towards the west end, or to my right over here. There's a room where we're doing BMI and we're doing body fat. We will be able to give you the numbers for your risk if you are overweight or if you are obese. And the thing about it is that we chose that room because it's a fairly private area, and you know we don't want. I know a lot of it's kind of sensitive. You know, I don't like to get on the scale, but you know a lot of us don't like to get on the scale because we don't like to see the numbers. But you know, I think it benefits us, and I will tell you. And if I have any of my participants from any of my weight loss studies, and I see someone who I think might have been in the study, we promote weighing yourself weekly. So the only way, we like to get you to weigh yourself like 3 or 4 times a week, but you know, sometimes it's hard to get on the scale, especially if you know you've maybe cheated. So let's talk about the things that we know. Now we know the risk factors. What can we do to prevent and or treat metabolic syndrome? Well, if you look at this little puzzle, jigsaw puzzle, you can see that I think the thing that is the most important is looking at the center, and every one of the people that has been faced with these risk factors in our past studies know that the one thing that we promote here is diet and lifestyle change. So we want you to change for the life. Lifestyle means the life. So you don't just change for, you know, like some people say, oh well, I want to look good for my class reunion, or I want to look good when I get into the bikini that I wore 10 years ago. I mean, some of those things are kind of unrealistic for long-term lifestyle changes. So I think we want to do it for health. And you know, the one thing that we want to promote here is to not just continue to gain weight, but to try to make it plateau and keep it stable. So the current thinking today is that treating the individual components is a hallmark in addition to the lifestyle. The 5 components of the metabolic syndrome, every one of those components can be caused by obesity. And so therefore, most of the treatment options center on treating the weight issues that one has as the first line of attack. I like this. I have to tell you that when I used this little cartoon in a different slide, and I actually changed the name to be my name on this thing. Fed up with how her diet is going, Catherine takes a more serious aim at her target weight, and I think we'd all like to shoot that scale. But here's some facts that I think that you might find of interest. The National Weight Control Registry is a long-term registry started by some academic researchers who but all of whom I know actually. But it is comprised of 80% women, and these women within this registry have lost, and I can't remember how many women, how many people there are. I think it's several thousand people, but the average weight loss has been 66 pounds, and it has been kept off for an average of 5.5 years. I think in order to get yourself enrolled in the registry, you kind of have to have proven that you have lost weight and you have maintained that weight loss for a long period of time. The averages, though, hide a lot of diversity within these individuals. Some people have lost 30 pounds. I think that's the minimum to get into the registry. Some people have lost 300 pounds. The duration of the successful weight loss has ranged. In some people have lost it fast, 1 year, and some people have kept it off for even 66 years. So these are probably women who were diagnosed at a very, very early age, and they've just made that lifestyle change. Some have lost, as I mentioned, the weight rapidly, others very slowly, and some people over as many as 14 years. So they may have kept it off for 66 years, but it may have taken them 14 years to lose the weight. And we've seen this from time to time in our weight loss study. Some women want to give up because they don't see results right away, but if you wait, you keep working at it, the weight eventually comes off, not up. And the other thing about this registry is 45% of the participants have lost weight on their own, and others have enrolled in programs to lose weight, like Jenny Craig or Nutrisystems or any one of these. But I'm impressed by the fact that 45% can actually do it on their own. We've got lots of weight loss books out there. We've got lots of tips. I think it shows you that you can actually do it on your own if you are dedicated and motivated enough. We had one study here that we were very discouraged because our control group lost weight. And the reason our control group lost weight, they were motivated and they were upset and they wanted to show us that they could lose weight. They didn't lose as much weight as the other, but they didn't gain weight either. So they were successful in my book. And I think that's what we need. 90 other factors about this National Weight Control Registry. 98% of the participants modified their food intake to lose weight. So they might have changed even the Thanksgiving dinner or the Christmas dinner, but they made a change and they modified their way of eating. And we have seen in other studies where changing, maybe tweaking, I like that, tweaking might be a better way to describe how you can change your weight, your food intake and be successful. 94% of the people have increased their physical activity. The most frequent activity was walking. So I think it all shows us that we need to walk more. In fact, I've been sitting too much at my desk, and I've got a little pain when I walk. So maybe if I walked more, then I wouldn't have this pain. That's what I'm going to do. I'm walking today, though. I'm going to be walking around a lot. Most of the people in the registry maintained a low-fat, a low-calorie diet and those high levels of physical activity. And I like these little things. 78% eat breakfast every day. So, eating breakfast every day helps to jumpstart your metabolism. So it doesn't have to be a big breakfast. It could just be, some fruit and yogurt like we have down here. 75% weigh themselves at least once a week, and probably some of them weigh themselves every day. 62% watch less than 10 hours of TV per week. So that's kind of interesting as well. And then 90% on average exercise about 1 hour per day. Now I exercise at my desk 8 hours per day, and when I get finished, I'm not wanting to go exercise around the block necessarily, but I've got to change that mindset, because as I get older, the legs don't move like they used to. You know that feeling, huh? So treating obesity then will improve all other factors. And I say obesity, but I mean overweight, whatever the level of overweight is. Your successful weight loss will improve your insulin resistance, so you may avoid that pre-diabetic state. Cholesterol levels will improve and blood pressure will improve. So those are all positive things. I do mention hypertension because of the age group here, and I'm always worried about, is my blood pressure going to elevate even more as I get older? And so I want to give you some tips. Limiting sodium intake or your salt intake, going to lower fat dairy products, 1% or skim, lowering your alcohol consumption, decreasing your saturated fat intake, and your saturated fat primarily comes from meats and dairy products. So that's why dairy products are great, and we've done a lot of research on it. And that research involved not only consuming low-fat dairy products and limiting your intake of meats, but it also encouraged a diet that was rich in fruits, vegetables, and whole grains, the DASH diet, which if you go to the area and get your BMI and your body fat tested, tested, I guess. We have copies of the DASH diet for you there if you don't have one. We've given them out like 2 or 3 years in a row, and the reason we didn't put one in your packet this year is because many of you already have one, and they're so popular. This is the 4th year in a row that U.S. News and World Reports has named the DASH diet the #1 healthiest diet and the #1 diet for the prevention of diabetes. And I was very much involved in that particular project and designed the final DASH diets that were used in the metabolic feeding study. So I take a lot of pride in talking about DASH because it's dear to my heart. And then, of course, lose weight and increase your physical activity. But the bottom line is that treating the individual components of the metabolic syndrome with an altered diet is a good objective, but often we realize that some of those treatments may include medication. The goal here would be to push all those components into the normal range. So all of those greater than or equal to, try to move towards a better number. And the bottom line is that Wellness Day for Women is really worth your time if you think about the fact that you get all this data that can educate you about where you are and perhaps put you forward to where you need to be. And I thank you for coming, and I hope that I have given you some good information here. And I'm going to be hanging around, so if you see me and you have a question, feel free to ask. I'll answer. Thank you so much.